Yeah, I'm excited to bring this information forward because most of the viewers probably haven't heard this from their general dentist or their medical doctor, and they're unaware that what goes on in your mouth has profound effects on what's happening in your whole body. And I'm often amazed in the 40 years, and it'll be 40 years in just about another week that I got my dental degree, and I'm amazed at how few dentists are really understanding the implications of the mouth as a mirror and gateway to the body, and how many physicians don't even look in the mouth of their patients that they're examining and kind of gloss over it. So without further ado, we will start the presentation today, and I am going to start the slideshow. So the mouth-body connection is a profound one. By background, my interest and involvement in biologic dentistry, which is a form of holistic dentistry or integrative dentistry, all of these terms refer to taking a little different philosophy, a little different approach to how we look at the mouth, and not just looking at symptoms of disease, but at getting at root causes. Quite simply, your oral health is the 800-pound gorilla in the wellness room. You cannot have a healthy body without a healthy mouth. You can be going to health coaches, functional medicine doctors. We're all trying to work with you to get your body healthy. They're working on your gut. They're working on your improving mental clarity and all these different things. But even Ayurveda says, in Ayurvedic medicine from India, says you cannot have a quote unquote clean body without a quote unquote clean mouth. That's not referring to whether you took a bath or a shower or brushed your teeth. It's referring to the elimination of two things and being free of two things that are the most debilitating to your overall health and wellness. One is inflammation, and the other is toxicity. And very often they are connected. So a long time ago, dentistry became unplugged from medicine, and this illogical division between dentistry and medicine is what's created this illogical disconnect between what's going on in your mouth and the rest of the body. So that was always perplexing to me. The book I wrote, which I believe we will have available, you can get this online, really clearly became this is a seminal work of a lot of my life's work in helping to communicate the mouth as a mirror and a gateway, and result, the healthier mouth, toxicity and inflammation in your mouth dysregulates your immune system. It's been linked to everything from cardiovascular disease to 5 different types of cancer, and we'll talk about that. My hero in the mouth-body connection is a man by the name of Dr. Weston Price, and Weston Price was a dentist. And in 1917, he was speaking on the relationship of mouth infection to systemic disease, and he was scoffed at. This was a presentation he gave to the St. Louis Dental Society. Dr. Price is well known in the world of integrative nutrition for his work, his epigenetics, epigenetic work on looking at the fact that infections in your mouth not only cause problems in your mouth and body, but it damages your genes and the expression of deformations in the mouth and jaw in subsequent generations. Really a brilliant man. But the mouth-body connection literally affects from the top of your head to the bottom of your toes. Everything, when we talk about gout, everything from Alzheimer's disease to gout, colorectal cancer, and heart disease, respiratory problems, diabetes, pregnancy complications, rheumatoid arthritis, all of it's connected. But we also see the mouth as a mirror. It's a very, very important mirror for what's going on in the body. So things like diabetes, HIV, leukemia, and all genetic syndromes, many different vitamin deficiencies, many different diseases in the body that have manifestations in the mouth. So we know the mouth is indeed a very powerful gateway to toxicity and inflammation, probably the largest gateway of toxicity and inflammation to the body. And the oral microbiota, which is also called the oral microbiome, is linked to many different diseases. And we see this interaction of our autoimmune disease and immunodeficiency disorders, this idea of a dysregulated immune system on the upper right. And this is really powerful. The idea that gum disease, that inflammation can dysregulate your immune system, making you more prone to serious, even deadly viruses and bacteria in the environment around us. So gum disease is not about bad breath and your teeth getting loose. It's about everything, all kinds of systemic disease in the entire body, including on the upper left, inflammation-induced carcinogenesis or cancer, hematological malignancies, impaired immune function again. And then we see all kinds of inflammatory diseases like rheumatoid arthritis and so many others from an activated inflammatory response from what's going on in your mouth. All right. So we're going to talk about this morning. I'm going to give you what are my top 10. These are my top 10 sources of chronic inflammation and toxicity in the mouth. We're going to begin with periodontal gum disease, which Time Magazine called one of the body's top sources of chronic low-grade inflammation. So when I use the word inflammation, inflammation can be a normal part of the healing response in the body. But when we talk about chronic inflammation, inflammation that doesn't resolve. So for example, inflammation as part of the normal healing response is you get a splinter in your finger, it swells up, it gets sore, it gets tender, it gets inflamed, and then it resolves as your immune system is working to eliminate the offending foreign body, being a little piece of wood that got stuck under your skin. However, chronic inflammation is the equivalent of a silent alarm bell going off that's not being answered. We're going to talk about jaw osteonecrosis, which was often unknown and not talked about in the dental profession for years, primarily because we couldn't see it on regular dental x-rays. We're going to talk about mercury fillings, often known as amalgams. We're going to talk about non-precious porcelain fused to metal crowns, which often have other heavy metals like nickel, cadmium, and lead. Titanium metal implants and the emerging research that's showing that these are, in fact, inflammatory to the body, and we'll show why. Titanium implants were generally accepted as safe and effective, but new research is showing that that is not the case. Endodontically treated, or what we call root canal teeth or root canals. Root canals have a lot of profound effects on the systemic immune system and are a source of serious harmful bacteria and bacterial byproducts that can harbor and remain trapped inside the thousands of dental tubules that exist inside a root canal tooth. We're going to talk about tooth-colored fillings, what we call composite resin, which can have BPAs. They're actually a plastic known as bis-GMA resin. That stands for bisphenol A glycidyl methacrylate. Well, bisphenol A is BPA, a very harmful chemical to the body that results in a lot of endocrine dysregulation. We're going to talk about another epidemic, a silent epidemic of, well, not so silent if you're a snorer, but a silent epidemic that of over 1 billion people on the planet that have it, and 75% of them are undiagnosed and untreated. We're going to talk about something called TMJ and occlusal disease, jaw and bite problems, and how those are a source of chronic inflammation and stress on the body, and what that does to your systemic immune system. And then we're going to talk about harmful oral care products. This is really been an area that I've spent 20 years of my life in research of, because most people are unaware that commercial oral care products, toothpaste and mouthwashes, were developed by the soap industry, the consumer products industry. Colgate, Procter & Gamble, Unilever were making all kinds of detergents for your hair, for your skin, for your clothes, and yes, for your mouth. So we'll start with periodontal disease. I believe this was the cover from a 2004 cover of Time magazine, talking about the secret killer, chronic low-grade inflammation, and its link behind heart attack, cancer, strokes, Alzheimer's disease, and this idea that chronic inflammation, often gum disease, doesn't hurt, there isn't pain, there isn't fever, very often there isn't swelling, but it's what we refer to as a stealth infection. The book on the right, I got to read when I participated in a Harvard Medical School program in complementary and alternative medicine back in the late 1990s. And this was by Paul Ewald, who spoke about stealth infections and their link behind the very same cancers, heart disease, and other deadly ailments. So, healthy teeth and gums look like that part of the tooth that's on the left side of the screen there. And on the right, we see advancing or advanced gum disease. And we see bacteria that normally live in the mouth, Porphyromonas gingivalis, when they get out of balance. And that's a key word that I'd like everybody to remember this morning, is this idea that bacteria in the mouth live in this community called the microbiome, right? We have 6 to 10 billion microorganisms, along with all kinds of various viruses and fungi that live in this robust community and ecology. And think of a healthy microbiome like a healthy organic garden. And we have been trying to kill that in oral care for years. Kill germs, Listerine, kill germs on contact, or let's kill the bacteria because we think of them as bad. They only become bad when they are out of balance. So remember that word, balance. That's often referred to in the microbiome as microbial homeostasis, or balance. When in balance, those bacteria that cause that damage on the left, when unbalanced, when in balance, they actually live in a healthy, supportive community that helps to keep your teeth mineralized and your gums healthy. So when out of balance, we see plaque building up, causing inflammation that creates a pocket between the gum and tooth. And we see these bacteria, P. gingivalis, promoting and feeding off inflammation. Bacteria get into the bloodstream. So we see the conditions on the right showing the relationship of these weaponized, I call it weaponized, when they're out of balance, they flip a pathogenic switch. So we went from this germ theory to the good guy, bad guy theory, what I call probiotic and pathogens, and that some bacteria are good and some bacteria are bad. That's just another misinterpretation, because bacteria are bacteria. They behave good when they're in a balanced environment. They behave bad when they are out of balance and stressed by using antimicrobial products in the mouth that disturb this very essential balance.